Okay, there are a couple points that Byron made that I'd like to address. First is the point about people should pay for their own health care. Well, I want to tell you a story about my former boss, who actually was a lobbyist for the Connecticut Hospital Association for 21 years. So this was not a man who was unfamiliar with the healthcare system. But 4 years ago, he went in for heart surgery and with 2 health insurance policies and ended up having to pay $25,000 out of pocket when all was said and done. How many of you in this audience could come up with $25,000 out of pocket, even with 2 health insurance policies? Also, he mentioned something about Medicaid recipients should pay copays. Well, there was a program in Arizona called Kids Care Parents, which covered approximately 10,000 adults in Arizona whose children were on kids care. These are people between 100 and 200% of the federal poverty level. These are average folks. 200% is about $45,000 a year. The legislature, in its wisdom, decided to eliminate Kids Care Parents. We now have 10,000 more uninsured in Arizona. These are working families. Kids Care Parents was a 3-to-1 match. For every dollar the state put into kids care, which was $6 million, they got $3 from the federal government, which was $18 million. Plus, those people did pay premiums. They paid almost $6 million in premiums. And they also paid copays when they went on to doctor visits. They do that for kids care as well. Those are both Medicaid programs that are administered by the state of Arizona and are in every state in the union. The CHIP program, which is our kids care, is the one that President Bush vetoed 3 times. Now, I do have to give President Bush some credit. I represent the federally qualified health centers, which operate in medically underserved areas in every state in this country, and they have done so for over 50 years. They provide primary health care. It's comprehensive health care. It's considered a medical home. They do everything from family practice to dental pharmacies. They have the whole 9 yards, and they are basically located in remote rural areas. And they also train doctors and that are coming right out of medical school and want to be primary care providers. It's called the National Health Service Corps. When a doctor comes to a community health center or a rural health center located in a remote rural area, they are given some loan forgiveness for committing 2 years of their practice to that particular clinic. And the hope is for those rural areas that those doctors are going to stay and become part of their community. Our community health centers are community run, they're community directed, and they serve the concerns of very vulnerable people in very vulnerable areas in our state and in other states. And it has become a model and an integral piece of the healthcare reform bill, because what they deliver is what's called a medical home. That medical home model ensures that you see a qualified primary healthcare provider when you need it, regardless of ability to pay. But most of our patients are either Medicare, Medicaid, or sliding fee scale, which means they pay a portion of their income for their services. And President W. Bush is the one who gave us the largest expansion of community health centers in the history of the Community Health Center program. So we owe a great debt of gratitude to him, but the point that I want to make is in America, we've become like the Sunnis and the Shiites. If it's a Democrat idea, we're going to fight it to the death. If it's a Republican idea, we're going to fight it to the death. But our federally qualified health centers are fortunate enough to have garnered support on both sides of the aisle because they know that the importance for our country is to have a healthy, well workforce. And with that, I'll relinquish the rest of my time.